Welcome back to Empowered. I'm Elizabeth Nomofsky. Today's focus is unique dental concerns for women. Basically, a healthy mouth equals a healthy body. So, Dr. Chu, what are some oral conditions linked to hormones and dental health, especially focusing on women?
So I think it's not just one or two hormonal conditions. I think it's overall, our bodies are constantly bathed with hormonal changes. So, as we mentioned, as you grow up as a woman, your body is changing constantly. So, and young people, when they start using the birth control pill, it just, you're navigating a different world. Some women with endometriosis or fibrosis in their system, they're on hormonal therapy. So the hormones the doctors are trying to balance, but for dentists, it creates an issue because inflammation becomes a higher, uh, it becomes much more important for these particular patients to maintain their mouth. As you go into menopause, as everyone knows, menopause just becomes an issue with burning mouth. You can get dry mouth. You can get a very sort of sensitive gums. If you have dry mouth at nighttime, you can cause inflammation because the tissues are dry. You're much more prone to infections. You're much more prone to cavities because food sticks around your teeth more. So hormones in general just play havoc in the mouth for women. So it's much more important for women to see dentists to regularly check their mouth, especially if they change the medications. If they're on osteoporosis medications, the bone medications can affect any surgical procedures in the mouth. You can have a high risk of what they call osteoradionecrosis, necrosis, which is bone infection after taking a tooth out, unless you tell the practitioner that you're on osteoporosis medications. So those are quite important because the infections can get quite severe. In terms of other conditions for women, bulimia, people that are anorexic, they create a lot of damage on their teeth because of the acidity and what they're doing. People that are on diets constantly, they fail to get enough nutrients to help fight off infection. And they also lack certain vitamins that will help with healing process. So there's a lot of factors that go into health for women, especially. And I think it's really important that women speak to their dentist and discuss their personal situation with them.
You know, this is such a wealth of knowledge. And now I'm going to take it to the next level because everyone is stressed nowadays. So we're going from
Mhm.
hormones to stress. How does stress play a role in the health of your mouth?
So stress in general creates a lot of problems in the body. So stress can cause high blood pressure. It can cause pulses to race. It can cause cortisol levels, which is something in your body that your body produces, and it just puts your body on a very sort of high strung fight or flight response. And what that does is it decreases your body's natural systems to fight off infection. So, in the mouth, for example, a lot of people hold tension in their head and neck and shoulder areas, which then goes to your jaw muscles. And a lot of people will clench when they sleep. And clenching creates hard pressure on the teeth, can cause fractures inside your in your teeth. Sometimes it causes microfractures that we can't see until you come in and say, "Oh, when I chew on my tooth, oh, it kind of hurts, and I can't bite down hard." And by that time, it's actually a little bit too late because the crack line has already been in the tooth. Your tooth might not split apart, but there's been injury already. So stress in that form, you should definitely get in a protective appliance, which we normally call a night guard, to help prevent damage to the teeth. We can't stop you from clenching, but we're just protecting our environment, which is the teeth, and we're protecting you from losing a tooth. So stress creates that type of response in the body, and the clenching and compression on your teeth can also cause bone loss. So you really need bone to keep your teeth in your head. They may look great on a mantelpiece, but they're not worth anything there. So you have to keep the teeth in the head in an area where the foundation is strong. So you don't want to lose bone. So a combination of bone loss from that compression, and probably if you're stressed, you're not taking care of your teeth, you're not brushing, you're not flossing, creates more bone loss. So everything just escalates from there. So just to manage stress basically just helps the body just calm down, and actually send a lot of my patients to the massage therapists because they're great at decreasing your muscle strain and the stress for the mouth. You can also get other issues like canker sores, cold sores. That's just your body telling you that your body's not healthy and you need to rest.
You know, just listening to you right now, Somebody will say, I have a sore tooth, but it is an incredible domino effect that, you're clenching your teeth, then you have a fracture, then you do this and you do that. And we really, really do need to take care of our teeth because once we lose them, we can't bring them back. So don't go away. We'll be right back with more of Dr. Chu.